Okay, welcome to Heart Rate Variability Devices Demystified, Wearable Data for Better Health and Performance. This is an installment of our Webinars for Busy Lawyers series, which aims to give you practical takeaways in 30 minutes or less. I am Rachel Casper. I'm filling in for Amy Levine as host. Those are very big shoes. But for the most part, I get to be passive. So LCL provides free and confidential services for Massachusetts legal professionals. We offer free and confidential consultations for mental health, recovery, well-being, and practice management concerns. We also have other resources on those topics, such as programs like these, which are recorded and published at lclma.org. We also have groups and other resources there. We're so grateful that you're spending your time with us today and for our presenters' time. We are going to take questions in the chat throughout. You can submit those at any time, and then we'll save them all for the end. And then the program, again, will be recorded, and then you'll receive a link to the recording by email if you've registered probably around this time tomorrow. So I'm going to turn it over to our presenter, Inna Khazan. Thank you so much.
Thank you so much, Rachel. It's really nice to be part of your program. Really appreciate the invitation. Hello, everybody. Our topic for today is to talk about heart rate variability. I've been working in the field of heart rate variability for over 20 years. I am a clinical health and performance psychologist, so I work with folks who struggle with things like chronic pain, chronic health conditions, anxiety, depression, things like that. And I also work with high performers who would like to do what they do better. I use heart rate variability biofeedback to help people. It's an incredibly powerful intervention. Hopefully, I'll give you a glimpse of that today. So I have a practice in Boston, and I also teach at Harvard Medical School, do research, teach in other areas. So it's my pleasure to be here. I will do my absolute best to give a good introduction to heart rate variability. We have about half an hour, so it will be a brief overview. I will focus on HRV as it applies to wearables, since that's what most of you are here for. I will frame it as giving an introduction, a general introduction of what your wearable devices might be showing you, what information they give you, how to parse through that information, what to do with it. And then after the first half hour, there will be another, potentially half hour for questions. So if you have more specific questions, for your device or what you are seeing, on a specific screen, or what, a certain pattern or a certain number might mean for you, please pop those questions into chat and we'll get to them. All right, so I am going to share my screen. One moment. And as much as Rachel and I were just talking about that, there will not be a problem sharing my screen. It's not showing me what I need. One moment. Oh, there we go. It's back. Okay. So, Rachel, if you wouldn't mind putting up that poll, I would love to see what wearable devices folks are using, if you're using anything at all, if there's specific ones, something else. So in the Oura Ring, Apple Watch, Whoop, Garmin are the most popular. Just love to see a breakdown of what people are using.
So it does look like we have 100% answered.
Okay.
Let's see. So Apple Watch is at 44%, Garmin 11, Whoop 11, Oura Ring 11, something else 15%, and nothing 19. And I think we did see in the chat a Samsung device mentioned. Yeah, we didn't include Samsung watches. So it sounds
Okay.
like at least one for those.
Okay. Okay. Wonderful. Thank you. This it sounds like among the current participants, Apple Watch might be the most popular. Um, this is helpful for me to get an idea. So I appreciate everybody participating. Oh, there we go. Okay. So your wearables provide you a lot of data, right? Heart rate variability is just one of those metrics. A lot of these wearables focus on sleep, and they give you information about the time you're awake, REM sleep, deep sleep, right? They also tell you, steps, exercise, calories. Some of them give you temperature, oxygen levels, respiratory rate. So not all of your devices are going to give you everything. I'm going to listing some of the most common metrics that your devices might be giving you. Of course, HRV is common to most of these. And then these devices will also give you various measures of stress or recovery or readiness or some version that is usually some sort of combined composite score that they have an algorithm for calculating, and it's not 100% clear exactly how that gets calculated most of the time, but it's some sort of composite score that just gives you an idea of kind of where you are for the day. So I'm not going to talk a ton of, well, I'm not going to talk about anything other than HRV and just a little bit about the measurements of sleep. Everything else is much more self-explanatory, and we are focused on HRV today. So let me start with defining heart rate variability. It is a number that you've probably seen many times, and it's not always entirely clear what it is, what information it gives you. Why is this such a big deal these days? Why are all the wearables measuring it? So heart rate variability refers to the changes in the time interval between heartbeats. So on the slide you see in front of you, this is an ECG tracing. Each peak labeled as R1, R2, R3, those are heartbeats. So if you were to, take your pulse, you can, go ahead and, put two fingers on your wrist or the side of your neck if you wish, and just feel your pulse. You feel a thump, thump, thump. Right, so each one of those thumps is a heartbeat, and it corresponds to these R peaks that you see in the ECG tracing. That's the contraction of the left ventricle of your heart, sending oxygenated blood out to the body. So that is what we refer to as the heartbeat. It's that thump that you feel. And if you were to count the number of those beats in a minute, you would get your heart rate. Right? So usually it would be 60 to 80 beats in a minute. That's your average heart rate. But as much as we often think of the heart rate as needing to be steady, your heart is actually not a metronome. We don't want it to be a metronome. The time interval between those individual heartbeats is constantly changing. So as you can see on the slide, we have interbeat intervals that are getting longer, right? So 882 milliseconds, 923, 883 milliseconds. So the heartbeats are coming further apart. The time intervals are getting longer, meaning that the heart rate is slowing down. We can determine something called instantaneous heart rate for each one of these individual interbeat intervals. So if your heart were to beat with 882 millisecond intervals at all times, your heart rate would be 68 beats per minute. If your heart were to beat with 923 millisecond intervals at all times, your heart rate would be 65 beats per minute, etc., right? 61 beats per minute. So the heart rate slows down as the interbeat intervals get longer. And then we have heart rate speeding up. So the interbeat intervals get shorter, the heartbeats are coming closer together, and the heart rate is speeding up, right? So we're going to 76 beats per minute, 89, etc. And your heart is doing this all the time. It's speeding up and slowing down, speeding up and slowing down. And we want that. Heart rate variability is a measure of healthy physiological functioning. We can have approximately the same average heart rate with very different heart rate variability, right? So heart rate and HRV are different measurements. So on the slide here on the The right-hand side, we see heart rate variability of about 5 beats per minute, right? So if we look at the way in which the instantaneous heart rate is going up and down, those oscillations are fairly small, right? It's only, it's varying between about, 70 and 75 beats per minute, with the average heart rate of 70. On the left-hand side, that average heart rate is still about 70, but you're seeing very different heart rate variability picture, right? So the heart rate is varying between about, um, you know, let's say around, from about 60 to about 80. So 20 beats per minute differences for each cycle, right? So the heart rate is speeding up and slowing down on the left with much greater range than it is on the right. And the reason we care about so much about heart rate variability is because it reflects the ability of our nervous system to regulate itself. It tells us, how well is your body able to adjust to changes in your environment? How well is your nervous system able to adjust to challenges that may be coming your way? And how well is it able to recover? On the slide, you're looking at the Yerkes-Dodson curve, which represents the relationship between physiological activation and performance. And you can see that, if we are very relaxed, if our activation is very low, so is our performance, right? And despite this myth out there that in order for us to be at our best, we have to be relaxed, that's actually not the case. In order for us to perform at our best with various levels of challenge, our activation needs to be at that optimal level. So in the top of this inverted U curve, we need to have a moderate amount of activation in order for us to be at our best. If we're overactivated, if we're on the opposite side of the inverted U and the downward slope, our performance drops as well, right? So we don't want to be overactivated, but we also don't want to be too relaxed as well. And this is where heart rate variability comes in. It allows heart rate variability tells you how well is your nervous system able to reach that optimal state of activation in order for you to be at your best in whatever it is you're doing, right? It can certainly be performance situations, you're running a race or you're giving a big presentation or, you're going up in front of a, particularly challenging judge, right? You're taking part in a negotiation. It might also just be how are you going about your day? Like, how are you doing in the office? How are you doing with your kids at home? How are you doing with your spouse, friends, etc. So any kind of performance, heart rate variability tells us how well is our body able to get to that optimal level of activation and then recover when that activation is no longer needed. Heart rate variability is associated with a very wide range of health and performance domains. Because we have so little time, I'm really not going to get into this. I just wanted to let you know that there is a lot of research telling us that heart rate variability is a very important predictor of basic health and performance. It's important for cardiovascular health. It's important for our ability to recover from stress. Our brain function very much depends on heart rate variability. Our athletic and cognitive performance is strongly related to heart rate variability. And psychophysiological health depends on HRV. So this is things like chronic pain, anxiety, depression, gastrointestinal conditions, headaches, things like that. So a full gamut of our health and performance is strongly related to heart rate variability. When our heart rate variability is higher, that means that the nervous system is stronger, more resilient, more flexible, and it translates to better health and better performance. Your wearables give you a time domain measurement of heart rate variability. So time domain means that it's your wearables are graphing your heart rate over time and giving you a kind of a composite of how much is your heart rate varying, right? So the estimate of your heart rate variability. There are lots and lots and lots of measurements of HRV, probably a couple dozen. that we're definitely not going to get into right now. I will introduce you to some of the most common ones and just give you something to keep in mind. Uh, we can track HRV as max min or peak to valley, and that's just the way in which your heart rate goes up and comes down, goes up and comes down. And this just looks like a tracing on the screen. There is something called SDNN, standard deviation of normal to normal interval. And this for this measurement, it's a statistical calculation of the standard deviation of all those interbeat intervals, right? So the software is gathering all those intervals between heartbeats and then just taking a standard deviation calculation, right? A fairly basic statistic. And that tells you how much are all of these intervals varying from each other. Um, SDNN is a measurement of all sources of heart rate variability. So it gives you information about activation, recovery, so kind of everything mixed together. Another measurement that you'll commonly see is RMSSD, root mean square of successive differences. This is also a measure of how much these interbeat intervals vary. But the difference is it's telling you how much are these is each one of these intervals different from the intervals around it, right? So instead of giving you information about how much is this interval different from all the other intervals, the way that SDNN does, RMSSD tells you how much is this interval different from the intervals around it. And because of that, it's more skewed towards giving you information about the vagal influences on heart rate variability. So this is measuring the strength of your vagus nerve, and some of you may have heard of it. It is a major self-regulatory mechanism in the human body. And it RMSSD is a better estimate of that general self-regulatory capacity. RMSSD is also a little bit less affected by artifact like your arms and fingers moving and just creating numbers that are not real just because of the movement and other kinds of artifacts. So RMSSD is just a little bit more resistant to that compared to SDNN. There is a way for us to break down your heart rate variability signal even further. In the limited time we have, I'm not going to get a lot into this, but we can break down your heart rate variability signal into component frequencies that tell us a whole lot more about activation and recovery sources specifically. Most of your wearables actually do not give you this information, but you might encounter the high frequency, low frequency, very low frequency in other contexts. So right now, I just want you to be aware of these terms. High frequency power from your heart rate signal gives you information about the vagus nerve specifically. Very low frequency reflects physiological activation. So, when we are more physically active, if we are, worried about something, we're going to see more very low frequency activation, whereas high frequency comes up as when we are in a more kind of stable, better regulated state. So now let's talk about how these measurements get reflected in your various wearable devices. The Apple Watch gives you your heart rate variability as SDNN, so the standard deviation of the normal to normal intervals, so that standard deviation of those interbeat intervals measured in milliseconds. It gives you daily measurements, it gives you trends, right? And the Apple Watch records heart rate variability occasionally when you're asleep and at times during the day. But these times are sort of not predetermined. The algorithm determines rather when it's going to take these measurements. On the other hand, the Oura Ring gives you RMSSD measurements, which is also in milliseconds. So if you were to compare your HRV measurement from the Apple Watch and the Oura Ring, they're both given in milliseconds. It kind of looks like they're giving you the same measurements, but they're really not. SDNN and RMSSD are both measurements of heart rate variability, but you can't truly compare them one to another. You can't say, if my RMSSD is 50, my SDNN should be this. They will be generally in the same ballpark, but they're not the same measurements. So if you have an Oura Ring and an Apple Watch, you will be getting different numbers, and because they are different measurements. So the Oura Ring measures your heart rate variability overnight, and then it reports nightly scores, right, and then trends over time. So it's the measurement interval for the Oura Ring is much longer compared to the Apple Watch, but they do both give you kind of average scores and then trends over time. The Whoop also gives you RMSSD measurements in milliseconds, and the Whoop measures your HRV during the last deep sleep cycle of the night. The Oura Ring measures for most of the night. The Whoop just focuses in on the last deep sleep cycle, and then it reports nightly scores again and trends over time. Now, a couple of things to keep in mind here. Heart rate and heart rate variability measurements, you generally don't have control over when they're taken. So artifact can be a problem. If your Apple Watch starts taking a measurement when you're exercising or you're moving or you're walking around, if your wrist where the Apple Watch is located is moving, um, uh, the way that the heart rate measurement is taken is based on how much of the red light that the watch is sending, through your body, how much of that absorbed versus bounced back. So if the watch itself moves at the time of the measurement, you're going to get, well, artifact, right? Incorrect numbers. It's the same thing with the Oura Ring. That's also a photoplethysmograph. So it's a measurement that has to do with the red light that's being passed through your finger. It's the same thing with the Whoop. They're all photoplethysmographs. So if there's a lot of movement happening, you will get artifacts. So not all of these measurements are may be accurate depending on what you're doing at the time the measurement is taken. So just gonna keep that in mind. If you get a very weird number that seems out of left field, it may have happened because of artifact. Especially with the Apple Watch, which takes like a little 5-minute segment. So if you happen to be moving during that whole time, right, you might get a weird number. The Whoop and the Oura Ring are taking their measurements more continuously at night, so the artifact, may not be quite as significant, but could also happen. And then something to keep in mind is that sleep during the night, so the quality of your sleep and the number of minutes of REM and deep sleep is measured based on movement and heart rate. So these measurements are approximations of what's really going on. The only way to truly tell you which stage of sleep you're in is by using EEG, by measuring brain waves, right? Electroencephalography. And obviously these devices don't do that. So again, just keep in mind, these sleep estimates are fairly good, but they're not exact. So the best estimates of sleep are just your total sleep time. Those are fairly accurate. REM sleep, the rapid eye movement sleep, which is associated with dreaming and important for emotional and psychological processing and recovery. So that's a kind of a mid-range as far as accuracy goes. And deep sleep, which is very important for physical recovery, is actually tends to be the least accurate. And deep sleep can be confused with just being very, very still and quiet. If you're doing a meditation practice, your device might think that you are sleeping deeply, etc. So again, you can use this information for general trends, but don't get too hung up on exactly how many minutes your device told you you're sleeping, because it can create a lot of anxiety for people, right? So these are estimates; they're not your completely accurate numbers. In addition, something like the Whoop, right, which measures your heart rate variability in the last deep sleep cycle. But whether or not you're actually in deep sleep, again, that's may not be as accurate as you might think it is. So we need to keep that in mind as far as the accuracy of those readings as well. When you have your HRV number, right, again, what is it telling you? It reflects the flexibility of your nervous system to mobilize on demand and recover once the demand has passed. Right? So it's very briefly, it's your capacity to respond, adapt, and recover. And we want to take that information with, with a grain of salt, because you get so much information and so many numbers, and those numbers can vary a whole lot. It can be very useful, or it can be very anxiety provoking, or it can just be like, I don't know what to do with this at all, right? It can be just not useful. So what the way I'd like for you to use or to think about using these numbers is, don't overemphasize individual daily readings. You will have variability in your heart rate variability day to day. And it's helpful to note specific effects on your HRV. If you've had a few glasses of wine the night before, your HRV the next morning is likely to be lower. If you didn't get good sleep, your HRV the next day is going to be lower. If you're getting sick, your HRV is going to be lower. Or if, on the other hand, you're on a wonderful vacation and you're sleeping really well and you're hydrating and taking good care of yourself, your HRV is going to go up. Right, so just use this as kind of clues. This is what's good for me. This is, this is where I could do a little bit better. But your HRV will be up and down most mornings, and if your HRV is lower one day compared to the other without an obvious reason for it, it's generally not a cause for concern. Trends do give you more information, right? If you've had several days of a downward trend, you might think about, do I need to slow down a little bit? Do I need to take a little bit more time for recovery? Do I need to focus on my sleep? Et cetera, right? Do I maybe need to reduce, alcohol consumption, or, things like that. So those trends are more meaningful, and this is over several days or even several weeks. And so if your HRV is on the way down, take better care of yourself. If your HRV is on its way up, that may mean that you're ready for a challenge, maybe something you haven't considered doing before, and now is a good time. So here's just an example. On the left, we have some readings from Whoop. Those are, the daily readings are different, but they're not wildly different. The Oura Ring in the middle, here the numbers are quite different from each other, right? They're varying from 83 milliseconds to the next day of 38, right? And then back to 89. So something happened here, right? And this can be meaningful. And well, what did I do this day? Like, did this really drop my HRV? It's something to keep in mind. And then on the right is the Apple Watch, and here the tracing is pretty uniform, right? So not a lot, the HRV is kind of not very high, but it's also not moving dramatically. So that also gives you information, and there's not a ton of change and not a ton of reactivity. And in a situation, might be nice to bring it up a little bit. Okay. So this is a screenshot from Whoop. Whoop focuses on recovery, and it uses HRV, resting heart rate, respiration, and sleep to give you a recovery score. We're not entirely sure how it determines it, so again, take it with a grain of salt and use relative change to tell you something, right? And don't get too hung up exactly on the numbers, but looking at trends can be helpful. This is from the Oura Ring, right? And it gives you readiness scores. Again, it takes a whole bunch of readings into consideration. And we're looking at general trends, right? If your readiness score is on its way down over time, take better care of yourself. Don't get too hung up on exactly what those numbers really are, but look at general trends. The Apple Watch doesn't give you quite as much detail, but it gives you snapshots into your heart rate variability. So this is like on the left is for the day, on the right is a trend. And again, you're looking at how much variability there is in this variability and what does it tell me. One way to actually work with heart rate variability, like you have all these numbers, like, well, what do I do to change it? Is there anything that I can do to actually train my nervous system's ability to regulate? And there is something called HRV biofeedback, which actually uses a certain breathing rate that stimulates your heart rate in a particular way, and then increases those oscillations of the heart rate. So it allows your heart rate to go up and down, and over time strengthens your body's ability to regulate, improves your heart rate variability, allows you to perform better under pressure, and it tends to improve lots of health outcomes, anxiety, depression, chronic pain, etc. So I'm not going to spend a lot of time on that because we are out of time. One app that you could use for that, and full disclosure, I helped design this app, so I am very much biased. But if you are interested in a app that can help you actually improve your HRV, there is something called Optimal HRV that will help you track and train your heart rate variability. And we are at time, so I'll stop there.
That is very interesting. Thank you so much, Ina. So I haven't seen any questions come in through the chat just yet. So if anyone wants to get any questions in quickly, please do. I did want to share that we actually had, well, a two-part webinar series on polyvagal theory and how that can be used specifically in the legal profession. And the second part of which I just dropped a link in the chat. Was really around that ethical decision making in the legal profession specifically. So I don't know, when we think about kind of the legal roles where prolonged stress can kind of vary over a bit of a longer trend, like I'm thinking in, litigation where there's trials, or transactional M&A whenever you have a, major sale or acquisition. Is there anything in particular to focus on, like kind of those longer term trends? I mean, obviously you want to note when you have those and look at those days differently, but anything else around that?
Um, so just using that information if you are, if you have a, really important meeting and a lot going on and you're waking up and your HRV is significantly lower than it typically is, don't panic, right? That's one. And two, it just means that, yeah, in order for you to be at your best that day, you may need maybe, just slightly better care of yourself. If you can, more nutritious breakfast, take a little bit of a break if you can, going into it, do a meditation practice, do some breathing. So just know that your nervous system is just a little bit more depleted. Even just knowing that can help you pay attention to your own reactions, and that can help you manage them a whole lot better than just knowing that maybe you're not at your best, right? And if you're seeing a trend of downward HRV coming up to something really important, and you're starting to see your HRV come down, you can be proactive around it. So, a few days before this important event, again, focus on sleep. Maybe reduce the number of meetings you have for the day, give yourself a little bit more time to recover. Maybe gentler exercise, maybe don't, go all out, if you tend to work out with a lot of gusto, maybe, give yourself just a little bit of a break, etc. So you use that information proactively. And
Sure.
HRV biofeedback, if that's something that you choose to do, it will help you just support your nervous system throughout. Regardless of what else is going on, it will help your nervous system respond in healthier ways, no matter kind of what else is going on.
Right. And I can imagine as you might see those interventions working in that same data, hopefully that would be motivating as well. So we did
Exactly.
have
Exactly.
one question around the hardware needed to use the app that you mentioned. Is that just available kind of across the board or anything specific there?
So there is a it's a wristband that you can purchase with it goes with the app, but the app will connect to most open HRV readers. So not the Apple Watch, the Whoop, or the Oura Ring, unfortunately, because the devices themselves are locked down. You can't connect that device to the app. But if you have something like a pull strap or some other HRV measuring device, right? You just need to make sure it's measuring heart rate variability and not just heart rate. Um, the uh, the measurement for heart rate is actually different from heart rate variability. And there are some devices that can measure heart rate, but they're incapable of giving you a good HRV measurement. So just pay attention to
Oh,
that. But something like a pull strap, which is probably the most commonly used heart rate wearable, will give you a good HRV measurement and will connect to the app that I mentioned. But it
got
also has its own fairly inexpensive, yeah, it's like 60 some dollars for that device.
okay. Got it. And I imagine there's more information, all those specs and such on
Yeah,
whatever website. Okay.
exactly.
All right. So, one other question is whether caffeine affects HRV.
Good question. Um, it depends on how much and whether you're looking at immediate effects versus long-term effects. So if you have 1 cup of coffee in the morning, it likely will not affect your HRV immediately. If you have 5 cups of coffee and over an hour, you will, your heart rate will increase and your HRV will decrease, right? So if you kind of, if you overdo it with caffeine in a short amount of time, the immediate effects will be lower HRV. Now, caffeine consumption over the long term in moderate amounts, it actually will likely increase your HRV because there is a lot of evidence coming in these days that caffeine is not the evil thing we used to think it is. It actually supports health in moderate amounts, right? If every day drink 20 cups of coffee, that may not be so great long term. But if you have, like 1 to 3 cups of coffee a day or something like that, over time, that will actually likely have a positive effect on your HRV.
Interesting question. Right. So, I know you've emphasized not to focus too much on the precise numbers in the daily readings and to look at patterns, but with that in mind, when might a person get concerned about their trends is another question.
So we do have norms for heart rate variability, and that's sort of the first general idea of, to get an estimate of where you are. HRV is highly, let me emphasize, highly age dependent. Once I hit 40, my HRV started coming down, and that's just how it is, even though, I do biofeedback training and generally take, fairly good care of myself. So age will absolutely decrease your HRV, so just keep that in mind. Of course, if you take good care of yourself and do whatever you can to keep your HRV up, that drop will not be as high as if you didn't take good care of yourself. But regardless, age will drop your HRV. So you could take a look at norms and see where your HRV is. Get a baseline, say over like a week or two when nothing huge is going on. Things are fairly stable. You can get an estimate of where your HRV is as a baseline, and then compare it to a norm, and it will just give you an idea, right, of where you are. If you are generally within that normal range, you're good. If you are significantly lower than that, yeah, that might be a good idea to maybe talk to your doctor, maybe just take a look at lifestyle factors and self-care and stress levels and things like that. If you're significantly higher than that, um, as long as you don't have an arrhythmia or there or like a significant eating disorder, those can give you high HRV numbers, not in a good way. But other than that, if your HRV is higher than the norm, well, that's great, right? We like to see that. Um, So then to come back to the question of, when do you need to start getting concerned about trends? If generally you are kind of in that, normal range, and it's been, say, a week and your HRV is just dropping. Um, it's a good time to evaluate. Generally, I'll start thinking about it like maybe 3 or 4 days. If it's just continuously dropping, I'll start thinking about, like, what am I doing? What's going on, right? Might I be getting sick? Have I not been getting good sleep? And often I'll know exactly what's going on, right? And a short-term drop in HRV is not necessarily a big problem. Like, I know if I just have a very busy week and I'm at a conference and I'm traveling and I'm jet lagged, oh, my HRV is going to be low for that whole week. But I know why, and that's okay. I'll just know that I'll need to take extra time for recovery afterwards. And that's okay, as long as my HRV comes back to where, it typically is, within, say, a week of ending that, crazy travel week. That's fine, right? That does not bother me. But if my HRV is dropping for no reason that I can figure out, I might need to think a little bit more deeply about it.
And that's an interesting, unique source in the eating disorder is like a false positive kind of source of that. So, and also related to that on the, I know, you showed us the inverted U, but we have a question here, which says, as I understand it, the bigger the difference in the HR and the HRV, the better. Is that a true statement? And then second question, is a 55 average HR and 302 HRV a good trend?
Okay. Um, okay. Bigger difference in heart rate and heart rate variability. So, I don't know if it's a sort of a complicated question. Your average heart rate, you want your average heart rate to be sort of on the lower-ish side, right? Kind of, maybe like 50 to 70, maybe 60 to 80, depending on your athletic level and age. Typically your HRV will be higher when your average heart rate is lower, but I don't think there is like we're looking for a specific difference, right? You might have an average heart rate of 50 and your HRV may be in the 50s as well, and that could be great. Right, so we're not looking for a specific difference, but your HRV will be higher when your resting heart rate is lower. Now, average heart rate of 55 is great, and HRV of 302 is probably not real. That's I'd be curious, like, well, how is that measurement taken and what units it's in and what device did that. But that may be artifact, it might be arrhythmia, there may be something going on, but that's not a typical HRV number. Just to give you a sense, for most people, I'm not adjusting this for age, by the way, but for most people, HRV would be like, say maybe like 30 to 70, somewhere there,
Maybe it was a
generally.
typo. Maybe it was a 30.
Maybe. For
Oh,
athletes, HRV can be like in the hundreds, like 110, 120, maybe a little bit higher than that.
not a
But
typo.
302 is likely not real.
Okay. Well, not a typo, but perhaps a different tech issue, or at least good to know that feedback from you. So thank you for that. We do have a couple other questions on the app that I'll get back to, but first one on I have PVC. Will that affect HRV numbers?
Yes, it will. If the reading is taken when you're having an episode, then yes, you will have you could get a 302. You could get a very high number, and it won't be real. So
Okay,
it,
interesting.
it's a if you absolutely can get a real readings, just make sure it's not happening while those PVCs are happening at the same time. Yeah.
Interesting. Okay. Another question, does meditation help improve the HRV?
Um, Probably yes. So the research data is a little bit mixed. Some studies show yes, very much so. Some studies less so. This probably has to do with the breathing rate. Um, for breathing is a major driver of heart rate variability. So when we do HRV biofeedback, we find each person's unique breathing rate that will maximize their heart rate variability. For most adults, it's between 3.5 and 7 breaths per minute. So when you meditate and your breathing slows down to about that range, the combination of mindfulness and that slow breathing will be quite helpful for improving heart rate variability. Uh, Meditation by itself, without a slowing down of the heart rate, again, the research there is mixed. There is a ton of uh, benefit to meditation. So if you're doing it, absolutely, great thing. I would say that if you want to improve its effectiveness even more, use the slower breathing together with it, and that will kind of give you the best of both worlds.
All right, so can you mention the app name again and then a question on whether it will work with Garmin watches?
So the app is called Optimal HRV. I apologize for the self-promotion. OptimalHRV.com is the website. There is a free trial that you can use. And again, take what I say with a grain of salt. I'm absolutely I have a conflict of interest here. And the Garmin watch, so the Garmin Phoenix, which does measure HRV, it should work with Optimal app. Um, it's been a little bit inconsistent. Some people have reported that it doesn't connect, but I know that it often does. So if you have a Garmin Phoenix, you can absolutely try it with the app. Most likely it will work.
Technology.
Yeah.
Okay, well, those are the only questions that I'm seeing right now. So unless anyone squeezes one in before we close, that might be it. So thank you again so much. This is very informative, great questions, great answers. Thank you. All right, just some more praise coming through. All right, thank you so much, and thank you all again for attending. The recording will be sent out within the day or so.
Thank you very much. I know this was very short. Hopefully it feels like, a good enough overview, and hopefully it also just left you with some questions that you'd like to further investigate and are curious about.
Yeah, such helpful takeaways, truly. Thank you.
All right. Thank you so
All
much.
right, enjoy your day. Thank you.